Colorado Springs.
Nearly 500,000 people.
Olympic City, USA.
Garden of the Gods.
Pikes Peak.
It's a growing city.
Our local government has a lot of employees. What exactly do they do?
How does it impact my life?
This is where you find out.
Behind the Springs, an inside look at your local government.
Hello, everyone. I'm Jen Schrader, and I'm grateful to have you listening or watching Behind the Springs today. I want to start this episode just kind of on a positive note. I know you've all heard a lot about COVID-19. Maybe you're tired of it. I don't know. I know a lot of people are, but at the same time wanting to be informed. And it's something that we need to continue to talk about. But I think it's really would be great to start this episode with a round of applause because we have some positive news today. Good news in the beginning of moving toward that light at the end of the tunnel in this pandemic. I realize there are skeptics and others who are maybe worried or unsure about getting this vaccine. And that is why it is my pleasure to welcome back Dr. Johnson, who is Medical Director of El Paso County Public Health. Thank you for being here, this time with some positive news.
Yeah, Jennifer, it's my pleasure to be here. Thank you for having me.
I really appreciate it. I want to start, of course, we'll dive into talking a little bit about the vaccine, but let me just get your personal take on the arrival of the vaccine. I would imagine it's such a relief, somewhat emotional, maybe even. How are you feeling about it after all these months of such unprecedented public health work?
Yeah, actually, it is an unprecedented time. It is a moment that's really quite historical for many reasons. And I have to agree with you, it was quite emotional. On Monday, I had the privilege of being at UC Health when the very first dry run of vaccines was given and saw some of my friends and colleagues that I have worked with in the hospital and emergency room receive those first vaccines. And to realize that we now have a really strong tool in our toolbox to help us in that prevention and development of herd immunity takes us that one step even closer to the opportunity to return to normal.
Yeah, such a relief and really emotional for a lot of folks. But I know there's a lot of questions out there about the safety of this vaccine. So let's get to that first of all. And it was developed quickly, and that does concern some people. So can you talk briefly about the process and then some of the concerns that you're hearing?
Yeah, so it's a pretty interesting thing as we look at vaccines. One of the longest was chickenpox, it taking 35 years, right, to be able to develop. And then mumps historically has been the quickest to be developed in 4 years. And so when we look at this in coming, from the lab into production in less than a year, it's really unprecedented. But we have been set up for such unprecedented times. One, we have now DNA and genomic sequencing that we've not had in the past. We also, in this instance, had the world coming together in collaborations that have never been seen before across multiple labs and multiple expertise to bring forward various options for these vaccines to be developed. And then we actually had investment from governments and from our pharmaceuticals as well as other leaders to help hopefully finance this so that we had the resources needed for that investigation, research, trials, and at the same time that those were going on, instead of waiting sequentially as we have in the past, we began to stand up the potential for manufacturing so that when we did have enough information that this is a safe and efficacious vaccine, there would be a vaccine that was already produced and ready to be shipped to the public for receiving it.
Whereas the normal way would have been to wait for that approval before you start production. And that's what sped things up a great deal.
Yes, and I think that in the past as well, that there has been some reticence to begin that production until you know that it's going to pan out, that the vaccine really is safe and efficacious. But our global scientific and production agencies have been doing these concomitantly because the risk benefit ratio and the need for it was so great that they stepped into that just very actively. And so that has shortened the time frame for that vaccine to be developed, to be tested, and now to be available to the public.
And what can you talk a little bit about what's in the vaccine? I've heard a lot of people ask, is it like the flu vaccine? Is it different? What's in there?
So there are various forms of vaccine, and we know that there were 10 vaccines that ultimately came, two from kind of each category. And the two that we're seeing coming forward right now is first the Pfizer vaccine. And the Pfizer vaccine is a messenger RNA vaccine. So it's just a little pocket of proteins that's held in a little fatty envelope that goes into your vaccine to give the picture to your cells so that they can produce the antibody, recognizing the spike protein or the piece of the virus that would cause you to get infected.
Okay.
And so then if you were to see the live virus, it already has an arsenal of immunity to begin fighting it before the virus can get a foothold in making you infected.
Okay. And the other common question I've heard from folks and seen online as well is just the issue of side effects, which every vaccine does have some side effects, but can you talk about what is known at this point?
Yeah, so this vaccine, and I just want to say really quickly, the Moderna vaccine, which will be following, we assume is following next week after another emergency use authorization from the FDA, is a similar messenger RNA vaccine. And we have information that the side effects related to this are just kind of that achiness and little low-grade fever, maybe a little bit of a headache. And what you're seeing in those side effects is actually your immune system responding to the vaccine itself. That is why we get sick, but we have a much more broad and long-term slope of those kind of symptoms that then become additive as the virus impacts our organs, such as our lungs, so we get short of breath. What we want is to begin to get the immune system revving up just a little bit and then having enough of a picture and it just kind of settles down because there's no attack from the virus itself.
Right. So that's what you're saving yourself is that those long-term effects, because people might say, well, what if all I get from the virus is a headache and a little yucky feeling, but you don't know exactly what the long-term effects may be.
Absolutely. And the virus has notoriously attacked our lungs and then our vessels. It's an endothelial virus. And so we can have multiple organs that get involved from our brain to our kidneys. And so this gives us the opportunity to kind of put, the picture in the army of our white cells and they go, you shall not pass. Right.
Right.
And that's
okay.
exciting.
It's amazing. Yes, it's amazing. When will we have a better sense of if we've reached herd immunity? I know you and I have talked about herd immunity before. When will we be able to, or how to gauge that?
Yeah, so this is going to be a process. It's not like we're going up to McDonald's and we get our hamburger and then that's it. We have some time that's going to be required here. First, when I get my first vaccine, there's two weeks before I begin to mount that first immunity within myself. But then at the third week, I have to get a second shot. It's a 2-shot series. So by the end of 2 weeks after my second shot, I should have 96%, 95% immunity to this virus. However, if I'm sitting next to you and you didn't get your shot, there's still that potential to pass it back and forth. And so we really anticipate people are going to need to wear their masks, maintain social distancing until we begin to get a percentage of the population that creates that herd immunity. And it'll be somewhere between 70 and 80% of the population getting the vaccine. Historically, that's what we've seen with vaccines, that we have to get to that greater percentage. But I believe what we'll see is not only the decrease in the numbers of cases that we get, but we'll see even of those cases who do get it, less severe symptoms because you won't have as big an inoculum. And so we will be following that data, not only of the numbers of people getting their vaccine and who's received their second vaccine, but also the numbers of people who may be testing positive and symptoms, hospitalizations. All this data that we've been tracking will help us to know when we're reaching that herd immunity.
I was going to ask, I know I don't mean to put you on the spot. I know you can't predict the future, but I'm wondering, is that 70 to 80% possible? Has that happened before with vaccinations? Is the medical community feeling confident that that may help? I mean, obviously, programs like this and information, getting the right information out to ease those worries is part of that. And it's hard to predict, but what are your thoughts?
Yeah, I mean, we can reach those types of vaccine rates in our pediatric populations on childhood immunity or vaccine shots, right? Getting them up to date so they can go to school. And we have been able to eradicate smallpox. We see a huge impact on polio and measles. There have been some, kind of kickback more recently in that, and we've had some outbreaks in measles in pockets of our population that have not wanted to get vaccines. And so there still is that concern. And historically, we've seen about 40 to 50% of people have uptake of the flu vaccine. So we are quite aware that there is some reticence historically, particularly in our adult populations, but this is a vaccine that is safe and effective. Based on all of the data we have, it has followed the same processes, even though the timing, for all the reasons we talked about, has been shorter. And when we look at any time we get a vaccine, it's that risk-benefit ratio. And I do believe that when you look at some of the outcomes and the way that COVID has shut not only some of our health down, but our economy and schools and that kind of impact, it makes sense to get vaccinated.
That's right. That's a wonderful message. So, to conclude, it's obviously going to take a little while to get everyone vaccinated.
Yes.
And I hope people know by now that those basic steps that we have talked about and that people are probably sick of hearing about are key. And I don't really care that they're sick, right, of hearing about it because they're so important. So let's go over those prevention steps that are still so important. I mean, it's tempting to think the vaccine is here and to sort of almost unconsciously let our guards down. So what are your words of wisdom for that?
Yeah, that is really tempting. I know that we're all really tired of this process, but the light is there, and you have to remember that as the vaccine starts, it starts like a little trickle of water in the desert, and we are awaiting increased flow of that water, and it heralds that there are storms coming. So we have to stay the course. Wear your mask, keep the 6 feet of distancing, keep washing your hands and cleaning surfaces, keep your group small and don't intermingle cross households. Stay home if you are sick and not feeling well. Get tested, and if you've been in contact with somebody who has known COVID, make sure that you quarantine so that you can break the connection of that infection. But also, when it comes time, get vaccinated. This is our most powerful tool we have in the toolbox for prevention. And really, we can do supportive treatment. We can give you Tylenol. If you end up in the hospital, there's supportive treatment, but we don't have a cure for this. We have prevention. That is our biggest piece in the arsenal. So it's a really exciting time. And it is a time to maintain our diligence and patience moving forward.
That's so true. And speaking of moving forward, I do want to emphasize to people that, and you and I have said this all along when we've talked, it is critical, especially when it comes to this vaccine, just as it was during the beginning of the pandemic, to rely on those sources of information that are credible.
Yes.
And so people can continue to rely on you all. El Paso County Health.org is a wonderful way to find out, where do I get tested? What are my symptoms? How long do I quarantine? All those questions can be answered. But also to get reliable information about this vaccine. If people want to research it further or have additional questions, what do you recommend they do?
So can't emphasize enough having reliable resources. There's a lot of myths and a lot of fear that is going around, particularly in social media. And so I think there are known websites that are helpful: CDC, the El Paso County Health.org, but also Johns Hopkins has a great website, and they have a bunch of webinars you can check into. Our hospital systems, UC Health, Centura, and Children's are also great resources as you look for that information. So be really careful that you vet this well.
Right. Listen to the experts and not, Uncle Joe or whatever on social media.
Yes. Yeah.
To put it bluntly, right? I mean, there's just so much
Exactly.
out there. You're right. Yeah. Everybody has their
Absolutely.
opinions and they're not all well researched. So it's important to do your own research and get your own information from those correct places.
Yes.
Okay.
Absolutely.
Is there anything else that you want to leave everyone with as a message? Or, I mean, I think just that there's hope and promise, I think is wonderful.
Absolutely. And I'd like to speak to, we have had this surge through October and November, and there's been a lot of conversation around that. And we had appeals and had to move to red right
Yes.
after Thanksgiving. But I can tell you that we are past the potential time frame we would have expected to see a surge from Thanksgiving, and have not seen that. And in fact, we're beginning to see some downward trends that are very hopeful. So I just want to thank the El Paso County and Colorado Springs community for the diligent work that they have done in prevention, because the proof is in the pudding. We're seeing some changes here that I think reflect people's willingness, even if reticent, and their compliance with wearing their mask and doing that social distancing. So as we go into these holidays with Christmas and New Year's, let's just, in our solidarity, agree to stay the course, because we do have additional tools coming. There is light at the end of the tunnel, and I feel like we have already proven we can do it. So let's build on what we've done.
That's right. People are reluctantly sacrificing, but they are
Yes.
sacrificing. And so that is no small task. So I think it's wonderful to say thank you to
Yeah.
everyone, and to just say, stay the course.
Let's honor what we've done by staying the course, so we keep adding on it and see what the benefits of that are, which that will eventually move that dial back, and we'll begin to open the economy. And as we do that, we have vaccine that is another one of those layered preventive measures, and even stronger than the ones that we implement individually. So let's do it, Colorado Springs.
All right. Thank you. And thank you so much for all of your work that you've done and continue to do. You're appreciated, and the whole staff at El Paso County Public Health. We appreciate
Thank
all
you.
you're doing. So thank you for joining us, and thank you everyone for listening. And again, follow El Paso County Public Health on social media, and the city and the county, and those reliable sources, so you can get the information you need and deserve. And thanks so much for listening and watching to Behind the Springs. Have a great day.